Stroke is the second leading cause of death in the world and particularly affects developed countries. Hospitals around the world are trying to make the time between symptom onset and treatment delivery as short as possible.
Heart infarction needs the same quickness of response. There is definitely an increase in this type of patients and an increase in the need to diagnose those patients, to find early when the patient is not well, and to get only hospitalization in people who are really needing those hospitalizations.
The main objective is to create an integrative digital platform, allowing the implementation of specific use cases and preparing the subsequent implementation of future use cases.
The envisioned open digital platform will connect apps, services, health-related IoT devices while exchanging all kinds of sensitive, relevant data and content in real time, in a secure and reliable way.
So HRS and NTT did team up together in what we call a call for projects on 5G, which is initiated by the Ministry of Media and Telecommunications, based on use cases, for instance, like stroke that has to be treated in a very early time frame. We are able to start the treatment before the patient arrives into the hospital.
What we will bring really together with this use case is, on the stroke unit, really bring the neurologist directly to the incident place. What will this mean? When the securist is near the patients, then the neurologist will make a direct connection to him. So he will see him virtually in place and can, with the urgencies together, take the right decision to the patient. So when the people has a question, when he has to do a checklist, when there is an alarm, everything will be then centralized from the hospital, from the IoT platform with the 5G connection.
The transition from hospital to home is a high-risk period in the continuity of healthcare, where adverse events are most likely to occur. One such adverse event is hospital readmissions and is associated with high morbidity and high costs. Heart failure is one of the most common conditions associated with hospital readmission, 30% at 1 month. Properly implemented, telemedicine, home monitoring and mobile empowerment apps have been shown to be effective in improving home care, patient outcomes and reducing hospital readmission rates.
We have launched a call for projects, and out of all the projects that came back to us, we could see that there are two very exciting projects about health and monitoring health of patients. We are very happy to see that 5G is getting used in those projects to really have a constant surveillance of patients. It allows indeed a much better monitoring of their health parameters, but there's also for the patients to feel much more relaxed and much more comfortable, especially if they are already back home and in a remote location. So there's a less time spent at hospital, a greater well-being felt by the citizens, and this is where you can see that new technologies can really be used for the benefit of the citizens.
You have to build a bridge between the place where you can do the first treatment and the platform in the hospital and the doctor. And this is via the 5G transport that we are achieving this. So that's the link between securely building up a connection towards the use case in the ambulance, towards the platform back in the hospital.
We think that as a small country, we have the short distances, the good connections to really help citizens and businesses to really foster and develop a nice ecosystem where we can all move forward.
I'm very proud that HRS is helping our department to evolve. We need a whole community of people working together to find solutions and to make those solutions work.
We know that the future of medicine will be connected devices, will be artificial intelligence, will be Internet of Things, connecting all partners around the patient. In that sense, we really want to be one of the leaders in this future development.
It is this profoundly human element we shall never forget, while technology will be adding significant value to the way that healthcare is delivered, and while the patient's role evolves from passive, and one being treated, to jointly active, taking care of his health together with the doctors and nurses.
We started here something which will be huge, and I mean, it's just the start of a journey.